Hi, today it's April 24th, 2022. I would like to greet everyone, and my name is Yanick Dantiste. I am a family nurse practitioner, and today I decided to tell you what is a family nurse practitioner, how I have become a family nurse practitioner. Okay, the road that I took to become one. So before we start, as usual, we're going to go to God's words about sickness, because my channel is about health promotion and disease prevention. So let's see what God said about sickness. We're going in Matthew 8:17. Matthew 8:17 state that it might be fulfilled, which was spoken by Isaiah the prophet, saying, "He himself took our infirmities," that's meaning Jesus took our infirmities and bore our sicknesses. So this is the word of God about sickness. So now we're going to tackle exactly how do I have become. Every time I come to the channel and I told you that my name is Yanick Dantiste, I'm a nurse practitioner. Somebody doesn't know, so I took the time today to explain to you exactly how do I become a nurse practitioner and what is a nurse practitioner. So my journey to become a family nurse practitioner. So I started, I was born in Haiti in 1963. Then in 1975, me and my family, we migrated to Canada. So at age 12. So I got my my Bachelor of Science in Nursing at University of Montreal in 1989. And so in 1990, Canada was too cold, so I came to Florida in 1990 to work as a nurse. So meanwhile, I work at Mount Sinai as a cancer nurse, oncology nurse, med-surg. And I decided to go back to school. So I went to Berry University in Miami, and I completed my Master in Science Nursing and Family Nurse Practitioner. I completed it in 2001. So I've been a nurse practitioner for more than 20 years, and I've been working in West Palm Beach, VA since 2002 as a nurse practitioner, family. But at the VA we deal really with elderly, so I do geriatrics as well. So what is a nurse practitioner? A nurse practitioner is a type of provider. Okay, it can be in the state of Florida. It can be MD, medical doctor, DO, this is doctor osteopathic, and P, which is what I am, nurse practitioner. In nurse practitioner, you can have a certification in adult, in psych, family. So me, I decided to do it in family, which is I cover more. I can I can treat children, from baby to 100 something. A nurse practitioner who is qualified, this is a nurse who is qualified to treat, first of all, before that, so what do you need? What somebody need to become a nurse practitioner? First of all, you need to have an associate degree in nursing from an accredited nursing program, and also you need to have a registered nurse license. And They also, the prospective student must have a strong academic history. So the requirement vary per individual program, but usually they require a GPA of 3 and above. And also, to be a nurse practitioner, to become a nurse practitioner, at least you need 1 year or more of clinical nursing experience. And also the school going to ask you 2 to 3 letters of recommendation. So this is all the requirement you need to become a nurse practitioner. So what is the difference between a nurse practitioner and a doctor? So everybody wants to know that. The main difference between a nurse practitioner and a doctor has MD or undergraduate degree. So moreover, a doctor might be a DO as well, so doctor osteopathy. And on the contrary, the nurse has an undergraduate nursing degree. A nurse could also have degree in another field, and later or could take nursing training and get their master degree in nursing. So what are the goals of a nurse practitioner? Okay, the role of a nurse practitioner is an advanced. Okay, first of all, the nurse practitioner, the NP, is an advanced practice registered nurse who can examine patients. They can diagnose condition, acute or chronic, and they can prescribe treatments as well. So they can prescribe medication. They can, not all medication, but a lot of medication. Like in Florida, they just passed the law like a couple of years ago, less than 5 years, so we can prescribe narcotics. Before we could not. And also in Florida now, nurse practitioner can work independently. You don't need to have a collaboration practice with a physician. So as long as you meet the criteria, they ask you more. You need to have more CEUs, so you can practice independently. So like me, I have my independent practice. So yeah, so like I said, you can diagnose, you can treat acute and chronic illnesses or diseases. You can write prescriptions, you can write narcotics. But again, even though you can write it, but it's best practice, like if you deal with a mental patient, they have psychiatric problem, it's good you let the psychiatrist to prescribe their antipsychotic. Same thing goes for a patient with cancer. So it's good for the oncology to prescribe their treatment, their chemo. So mainly nurse practitioner, we deal more with acute and chronic diseases like high blood pressure, hypertension, MI, CV, stroke, diabetic, infection, so on and so forth. And nurse practitioner can order and perform also diagnostic testing. Like we can order chest X-ray, we can order CAT scan. Let's say somebody, they come with the patient fell and hit their head, especially patient on blood thinner. So we can order CAT scan to see if there's any brain bleed. And also we can do teaching. We advise with advising patient and family member, and counseling about health issues. So the nurse practitioner, really, we look at holistic health. Okay, we look mind, body, physical, and spirit. We look everything. So that's what I wanted to that's what I. So yeah, so I really wanted to distinguish, I mean, every time I come up, I come and I said I am a nurse practitioner. So I really want to make that different. I really wanted to distinguish what is a nurse practitioner, because not many people really knows what a nurse practitioner is. And especially now with the baby boomers, they are retiring, and I think it's a good thing. State in Florida, they really embrace us, nurse practitioner and physician assistants, so we can really help the healthcare system. And again, one last thing, nurse practitioner and physician assistant, we give low cost effective healthcare, which is good also for the business. On that, hopefully, I hope that helped a little bit to distinguish between nurse practitioner and a medical doctor or a DOs. On that, I'm going to wish you the best of health. Okay, bye-bye.